So now let's talk about 1-04, which is our glucose check and glucose management guideline. Now, this guideline incorporates both hypoglycemia as well as hyperglycemia guidelines in hopefully a simplified format. Now, we're going to start here at the top just with your clinical indications for glucose check. Now, in general, if you start an IB in the field, go ahead and check a glucose. Just make it a habit. But absolute indications for glucose check are any alteration in consciousness. That's confusion, that's lethargy, that's agitation, anything that is not a person sitting who is alert and oriented and talking to you normally. The other thing is any seizures or stroke symptoms need to have the glucose checked. One big thing, and you'll see it highlighted there, not necessarily drugs, but especially with alcoholics, if there's substantial alteration in consciousness, go ahead and check a glucose to be on the safe side. They don't have the liver's ability to maintain a euglycemic state a lot of the times, and even though they look intoxicated, they can actually be profoundly hypoglycemic at times. So, when we look at the guideline, we'll go down here, and obviously, if we check the glucose, there's kind of two things, and one of those is low, and one of those is high. Low, we generally, talk about a glucose level less than 60. However, there are people who will be sitting and talking to you with, glucoses of 20 potentially, and there's people who may have symptoms consistent with hypoglycemia, with normal glucose levels. So always treat the patient and not the number. The other thing too is your device may fail and give a false reading. So, one thing is, regardless of the number, if you feel like that patient is exhibiting signs of hypoglycemia, give them glucose. We would rather it run high than too low. Now, for the agencies that are carrying oral glucose, you can give them, an EMT can give them a dose of oral glucose. The other thing is, even if it's something we're not carrying something, make these people a peanut butter sandwich. Grab something, a candy bar out of their house. I mean, if you want to be nice to them and give them something, go crazy. And but giving them initially glucose and then some sort of protein to maintain their blood sugar later on. Obviously, if they're substantially altered and they can't tolerate anything orally, we're going here then to our D50. And that's going to be 25 grams or an amp of it, IV or IO. Pediatrics, you need to water it down. You don't need to be giving them the concentrated D50. That's not good for their veins. So you need to water 1 milliliter of D50 with 1 milliliter of normal saline for each kilogram of the child. So again, that's 2 mLs per kilogram of D25, but it's a 1-to-1 mix. If you carry glucagon, you can use that as well, although most agencies aren't carrying it due to cost and availability issues. Sometimes patients will actually have it on them, and you're welcome to use that if it's theirs as well. Obviously, kind of going down here then, to the bottom, every time you do any sort of intervention, that's oral, that's IV medications, 15 minutes, recheck it. Or sooner if there's any indication that it may be dropping again. And then obviously, this is going to cycle. You're going to recheck it, treat it, recheck it, treat it, recheck it. Now, the other side of that obviously is if it's high. And this can be, we generally consider high more than 250, although, some people tolerate blood sugars of 500 to 800 without substantial issue. And most of the concern with high blood sugar is not the number itself, but the dehydration that's associated with it. So generally for patients who you can get IV access on, who have substantially high sugars, or who have signs of DKA, usually altered mental status, abdominal pain, vomiting, and this can actually be seen even with normal blood sugars. If they have those signs, you'd probably be starting fluids on them anyway, but the treatment for the sugar and or the dehydration is the same. And in the field, it's just saline. or lactated reamers if you would like to do that as well. But again, if there's any question or concern, please let me know. Have a great day.